Good morning, everybody. Hello, good morning, good afternoon, and good evening, and welcome to World Obesity Day 2021. I'm Johanna Ralston, and I'm Chief Executive Officer of the World Obesity Federation, and I thank you all for being here on this exciting and important day. It's now my pleasure to turn over to our World Obesity Federation President, Professor John Wilding. Thank you.
Thank you, Johanna, and it's a great pleasure to welcome everybody to this World Obesity Day presentation and meeting with the WHO to talk about obesity. As I've said, my name is John Wilding. I'm Professor of Medicine at the University of Liverpool and currently President of the World Obesity Federation. We've released a report today which has highlighted some of the very close associations between COVID-19 and obesity, and also reiterated our Roots Declaration, making the point that it's really important that we recognize obesity as a disease, look into strategies for monitoring, prevention, and treatment of obesity, and that recognizing that this requires a system-wide approach. The objectives for today's meeting are to discuss priorities for policy action on obesity in the context of COVID-19, to listen to those people who are working on the front lines, addressing obesity across a whole range of contexts and sectors around the world, and to announce a new global obesity coalition that will bring different stakeholders together to lead, coordinate, and drive action on obesity around the world. I'm just going to share our agenda now. We're going to hear some opening remarks from the WHO Director General, Dr. Tedros Ghebreyesus, and we're going to hear some recorded messages of support from Michael Bloomberg, Henrietta Fore from Unicef, and then we have a panel discussion which will allow us to have some real questions and answers to look at priorities and challenges from those working on the front line in obesity prevention and treatment. We're then going to hear some reflections from Nancy and other members of the audience, and I will be closing the meeting with some reflections of my own. A few housekeeping points. If you can just ask you to rename yourselves with your full name and organization, which I've failed to do because I haven't said World Obesity Federation in my introductory, in my...
That's because I'm addressing him.
You will be able to share verbally during reflections, but if you can use Q&A function for questions in the chat box to make comments, that's absolutely fine. We will be recording the webinar, and that will be shared with attendees. If we're not doing Chatham House rules today, you're quite welcome to tweet anything from this meeting using the hashtag World Obesity Day. So I think that brings that part to a close, and it's my great pleasure to introduce Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, a previous Minister for Health in Ethiopia. And I understand, Dr. Tedros, that it was your birthday yesterday. So happy birthday for yesterday. And I'm going to hand over to you now.
Thank you very much.
Introduce this meeting. Thank you.
Thank you. Yeah, thank you. Thank you very much. Thank you. By the way, I share my birthday with my daughter. So she was born on the same day too, March 3. Thank you so much. I will also pass your good wishes to her. So thank you, John, again. Dear Mike Bloomberg, Excellencies, esteemed guests, dear colleagues and friends, good morning, good afternoon, and good evening. It's a pleasure to be with you. Although World Obesity Day is an annual event, the terrible impact of the COVID-19 pandemic over the last year makes our gathering today more important than ever. COVID-19 has underscored, preyed on people with obesity, who are more likely to be hospitalized and have a higher likelihood of severe disease and death. At the same time, the pandemic has made combating the obesity epidemic even more difficult. It has made it harder for many people to engage in physical activity, while economic hardship and distribution disruptions have reduced access to safe, nutritious food. Isolation has also increased dramatically, often leading to psychological distress that worsens obesity, as you know. Worldwide, obesity has nearly tripled since 1975. As of 2016, more than 650 million adults were obese, or about 13% of all adults globally. Prevalence of obesity for children more than doubled over the last 2 decades. Comprehensive, coherent strategies are needed for the effective and sustainable prevention and management of obesity, a disorder caused by multiple factors which affects people in countries both rich and poor. The health impacts of obesity are wide-ranging, including diabetes, cardiovascular disease, cancer, depression, impotence, organ disease, birth complications, and sleep disorders. Children with obesity are more likely to experience anxiety, depression, and bullying, which can lead to a vicious cycle. Obesity and the illness and disability it causes imposes a significant economic impact in terms of health costs, lost productivity, and the associated drag on economic growth. The World Health Assembly set targets for overweight and obesity reduction in children, adolescents, and adults, but we still have a long road ahead, and the pandemic has set us even further back. We need to reverse the trend in 3 ways. First, we need to fight obesity with public health tools by scaling up actions to prevent, control, and manage it. Preventing obesity starts with good maternal nutrition and managing weight gain in pregnancy. Good childhood nutrition is critical. Healthcare providers must actively support breastfeeding, especially for families in stressful circumstances. The responsibility goes beyond the family. Employers need to promote a family-friendly workplace where women can nurse their infants. And we must continue to confront the efforts of the industry to undermine breastfeeding by promoting breast milk substitutes. Breastfeeding must be accompanied by nutritious complementary food and limited sugar intake at these young ages. Unfortunately, most products intended for children have a high sugar content, such as cereals, dairy products, and many snacks. And we also need to create an active society, active environments, and active systems following the recommendations in the WHO Global Action Plan on Physical Activity. Second, we need to fight obesity with financial and regulatory tools to make healthy diets more accessible and affordable. This means using pricing tools such as taxes and subsidies and regulating the marketing of foods to children. We must clearly inform people about the nutritional content of the food they're buying and consuming in a way that even young children can understand. This also means ensuring that only healthy foods are served or sold in public institutions, such as schools, hospitals, community centers, and government offices. Third, we need to fight obesity with clinical tools by providing quality care for children and adults who live with obesity. WHO is developing locally adaptable, science-informed recommendations for care of children and adolescents with obesity and for young children at risk delivered at the primary health care level. Excellencies, colleagues, and friends, like COVID-19, obesity is a global challenge that can only be met with a global response. We must work together across institutions and disciplines to provide practical solutions to reform food systems, to address the underlying cause of obesity, and to help people achieve and maintain a healthy weight. WHO is pleased to partner with the World Obesity Federation, UNICEF, the Bloomberg Foundation, and other stakeholders to share perspectives today as we join together to fight the obesity pandemic. This is also a special year because the UN Secretary General has convened the Food Systems Summit, which gives us a unique opportunity to take action to reverse the obesity crisis. With public health tools, financial and regulatory tools, and clinical tools, we can bring this devastating global disorder under control. We owe it to our children and the children of the world to give them an environment where nutritious food and healthy diets are the norm, not the exception. I thank you. Thank you so much again, John. Back to you.
Thank you very much, Dr. Tedros. That was really, really helpful and fantastic to hear the support of the WHO for the work that is being done by the World Obesity Organization and by many other organizations around the world. We're now going to hear two messages of support. The first of these will be from Mike Bloomberg, who is the WHO Global Ambassador for Non-Communicable Diseases and Injuries, founder of Bloomberg LP and Bloomberg Philanthropies, and the 108th Mayor of New York City. We will then hear immediately afterwards from Henrietta Fore, who is the Executive Director of Unicef. We're going to hear those right away now. Thank you.
Hello, everyone. Today's event focuses on a different global epidemic, obesity. 800 million people around the world live with obesity, putting them at higher risk for suffering from a wide range of health conditions. It also increases their likelihood of dying from COVID-19 by 50%. Obesity rates are rising fastest in lower and middle-income countries, and it's critical that governments and other leaders take steps to reverse that trend. Change really is possible. Bloomberg Philanthropies supports organizations and researchers working to encourage their governments to adopt healthy policies like sugary drink taxes, marketing restrictions, package warning labels, and healthy meals in schools. We've evaluated these policies, and we've seen promising results. For example, taxes have now been implemented in dozens of cities, states, and countries like Mexico, the UK, and South Africa. And again, we've seen them reduce sugary drink consumption. We've seen no evidence that these policies hurt the economy, but we have seen progress in the fight against obesity. So I want to thank the World Obesity Federation and the WHO for convening us today. Together, we can do even more to protect public health. Hello, everyone.
Today is World Obesity Day, a moment to reflect on an issue that's increasingly important for millions of children worldwide, in every country. Obesity profoundly affects children's growth, development, mental health, and also well-being. More than 340 million school-age children and adolescents are affected by overweight or obesity, a four-fold increase since 1975. But this is not the fault of children. It's a sign that something is wrong with the environments in which they live, learn, and play, and eat. Becoming Overweight or obese is the body's normal reaction and response to an abnormal environment, an environment in which foods are packed with excess calories, added sugar, salt, and unhealthy fats, and marketed to children, especially in poor areas where it's not always safe to be physically active outside. Environments in which these foods are not only more available, but are cheaper than fresh, healthy foods, where parents have few affordable food options. We need to turn this situation around, and we need to do it now. UNICEF's new nutrition strategy for 2020 to 2030 makes a universal commitment to address all forms of malnutrition among children, including overweight and obesity. We will work with governments and partners around the world to develop and implement strategies that work, especially where the needs are the greatest, in low and middle income countries. To do this, we need to do three things. First, we need to change the narrative around overweight and obesity. This is not children's fault or even parents or caregivers. It is the consequence of a food system that fails to provide easy access to nutritious foods and instead promotes foods that are unhealthy. Second, we need to adopt proven solutions. Countries like Canada, Chile, France, Mexico, Malaysia, the UK, South Africa are designing, delivering, and enforcing policies and programs that work. Food labeling, better school food policies, and putting an end to unhealthy food marketing that targets children. Guided by these examples, UNICEF will work with countries around the world to take action. And third, we need to give overweight and obesity the profile that it deserves in upcoming discussions around nutrition, food systems, education, and universal health coverage. UNICEF is proud to be working with our partners in the World Obesity Federation and the World Health Organization on this critical issue. On this World Obesity Day, let's commit to joining forces with civil society, academia, and donors to help governments and businesses take bold action to end childhood obesity for every child, everywhere.
Hello, everybody. I'm Johanna Ralston, and it's a pleasure to be back here. Professor John Wilding is, I believe, still on the call. That was a fantastic start, and we were thrilled with what Dr. Tedros said in terms of the WHO commitment to addressing obesity. We also were really pleased with what Mike Bloomberg and Henrietta Fore spoke about in terms of a shared commitment to addressing obesity. It's now my great pleasure to start our next panel. And before we do that, I want to just make one quick point about people first language. What does that mean? In relationship to obesity, I think many of you are aware of this, but we do have participants from more than 50 countries. I believe we have over 200 people on today, fantastically enough. This was an invitation-only event, but we have got fantastic participation by leaders from all over the world. People first language means that we remember that obesity is a disease and a risk factor, and that we describe people with obesity. We don't say obese people, we say people with obesity. And that we also think about the images and the language that we use. So I would ask us to all just try to remember when we're speaking about the challenge to speak to people with obesity. It's now my great pleasure to introduce our next panel. And as I say your name, I'm going to ask you to turn on your camera. So we've got three people who are working, we would say, in the front lines around obesity, people with who've been working directly with obesity all around the world. This morning I was asked by BBC, isn't obesity just a challenge of high-income countries and of wealthier populations and high-income countries? And I said, well, absolutely not. And of older people. And I said, absolutely not. It's of younger people, older people, everybody's affected, and it is in every country in the world. So today, to start with the youth voice, we've got the wonderful Faith Newsom, who is an aspiring obesity researcher based in the US, going to the University of Florida, who has experience as an advocate leader and also person living with obesity. I am also going to ask our other speakers to turn on their cameras and then to each introduce themselves. We next have Dr. Teo Suhoat from Malaysia, who is a medical lecturer and family physician. Stephen, if you could turn your camera on as well, who has been working in obesity in Malaysia for a number of years. And then finally, we have Dr. Colin Tuguitong, who is the inaugural Associate Dean for Pacific for the Faculty of Medicine and Health at the University of Auckland, a native of the Pacific Islands as well, and a longtime WHO and public health leader. Prior to coming to Auckland, he was Director General of the Pacific Community. So first, I'm going to ask each of our speakers, and apologies, I don't see Stephen. Let me just see if I'm missing that. Stephen, if you could join us as well, thanks. I'm going to ask each of our panelists to just briefly introduce themselves and say a couple of words, and then we'll start a discussion. And then I would ask afterwards people to start to pose questions in the Q&A box. Thanks so much. Faith.
Good morning, everyone. It's an honor to be here bright and early, 6 a.m. here in Florida. Like Johanna said, my name is Faith Newsom. I'm a first-year PhD student at the University of Florida working in obesity research, and that is inspired by my own personal experiences. I personally have lived with obesity for my entire life, and at the age of 16, I luckily had access to amazing care and received bariatric surgery. So after my bariatric surgery, I then went to college, geared with this passion about obesity advocacy and research, and I started an organization called OCEANS. OCEANS stands for Outreach, Community Engagement, Advocacy, and Non-Discriminatory Support, and we are a support and advocacy group specifically for adolescents living with obesity. I'm honored to be here and to be on this panel. Thank you again.
Thank you, Faith. Stephen, could you introduce yourselves to us? Next. Stephen?
Hello, everyone. I'm Dr. Steven Thiel, a family physician and medical lecturer from the University Science of Malaysia. Before I joined the academia 3 years ago, I was in the Ministry of Health of Malaysia, primary care clinics. So I have a mixture of urban and rural health clinics settings where I serve in. Now, I'm serving in an academic institution besides my clinical practice in family medicine. I provide patient-centered, evidence-based treatment to people living with obesity. And as a lecturer, I coach postgraduate students to be competent obesity researcher. And my research interest is in assessment and also improving knowledge, attitude, and practice of primary care providers in management of obesity. Today, I'm very honored to be in the panel and to be discussing on how we bring forward the agenda of obesity care. Thank you very much.
Thank you, Stephen. And now, Colin, could you provide a few words of introduction as well?
Good morning, everyone, and it's a pleasure to be here. I'm Colin Tuguitong. I'm a public health doctor, currently Associate Dean and Associate Professor of Public Health at the Medical School here in the University of Auckland in New Zealand. Until recently, I was Director General of the Pacific Community, a scientific technical organization working across the small islands of the Pacific. And for those who don't know, the Pacific region is described as the epicenter of obesity, but they've also developed some very innovative strategies to counter the impacts of obesity. I was, for a time, a staff member of the World Health Organization working on healthy diets and physical activity. Pleasure to be here. Thank you.
Great. Thank you so much. So I'm so excited to start just right in on a conversation with all of you. And what I'd really like to hear is both what you see as the primary challenges, but I think more broadly, as Dr. Tedros said, you know, the the World Health Assembly, the governing body of WHO, approved a series of targets around obesity 8 years ago now. It's been a while. And yet, saying that obesity rates, we'd flatten the prevalence essentially. And yet here we are. Rates are going up. They're going up in low and middle income countries. They're going up they're either going up less quickly in higher income countries. But and now what has this done? This has probably contributed to thousands of deaths, unnecessary deaths from COVID for reasons that we're still trying to understand. So why is it? What are the biggest challenges you've faced? How do you see those relating to this fact that that there hasn't been enough action, that there hasn't been, that the burden has still gone up, the challenge is still increased, even though we're supposedly having global targets around obesity that countries are supposed to be fulfilling. So Faith, I'm going to start with you, put you on the spot a little bit.
Well, I do have to say that in my experience, I have been extremely lucky, and I know that my story of access to care.
Okay.
Sorry, I'm so sorry about her. That is my puppy who we're from home. So
from home, it's fine.
Yeah. So I was extremely lucky to have access to care, but during my advocacy work, I know that that is not necessarily the case for everyone. And I think a lot of the issues are rooted very deeply in stigma. So not only access to care, but comfortability utilizing that care. And I think that that is rooted in stigma primarily.
You think
so
it's stigma?
I would cite that as the biggest barrier.
Okay, great. Stephen, does that match your experience? What would you say are the biggest challenges? And do you think that, how much do you think stigma plays a role, access plays a role versus other potential issues?
Thanks for the wonderful questions. So I would say that whatever intervention that we are doing that time, it may not be suffice to handle the obesity issues, whereby we need, because as we know, obesity is a complex multifactorial disease. And if what we are having, if it's only policy and we are not handling the issue of stigma, bias, and also the physiology, biology of obesity itself, it still won't do it. I would say that whatever intervention we are going to do it, must do it in a multi-sectorial. But that's why I'm very glad that we are having a mixture of group here. And from the list of attendees, I can see we have scientists, we have renowned clinicians, we have researchers. So these are the things that I would say the ingredients for our future success. It may not be the reduction of the prevalence of obesity, at least we stagnant first. That's what I thought of. And regarding weight bias and stigma, it's been there, and education. That will be depends on the education and policymaker on how they plan on it. And my perspective will be purely clinical. I would say that we need to train the clinician to be able to assess and treat and follow up the people living with obesity.
So obesity in primary care in particular could be quite useful. So Colin, I'd like to hear your thoughts on this.
Joan, a couple of points. One is, in this region, we've been fortunate to have had strong political leadership. We've had a number of declarations about this, that, and the other thing. Unfortunately, that political will has not been translated into resources for action. And when I say resource, I mean money, skills, equipment. So the political will from our leaders hasn't been translated into actions on the ground. The second is, I think these wonderful public policy statements have not been implemented because there's probably challenges with implementation. And perhaps a thought I'd leave for the group is how do we support, advise, guide in practical terms countries who want to take actions to achieve the goals that we've set for ourselves, either globally or regionally.
Great, thank you very much. Okay, so I think we're hearing a few different factors, though. We're hearing about stigma, about the need to address this in primary care, about political will not being matched by resources. I'd like to ask each of you now how you think, sort of combination of a couple of different thoughts. What are the priorities for action where you're based? So taking a slightly geographically based approach, and do you see benefits of greater coordination of those across the globe? Is that relevant to you? So I'm going to go back to Steven now. I'm going to put you on the spot, mix it up a little bit, and ask you what would be priorities in Malaysia and in sort of the region where you're based, and the benefits and challenges of coordination.
Okay, that's a wonderful question, because multiple strategies, but we still need to take the first step. For me, the priority will be medical education. So I would like to quote Will Durant, a philosopher, who said that education is the transformation of civilization. And to borrow that phrase into the context of obesity, medical education is the transformation key to obesity care. So I would say obesity, medical education in medical schools, in allied health teachings, needs to be incorporate obesity care management theory and practicals, and we will have the knowledge and experience, and also the sensitivity to avoid weight bias, weight stigma, or weight discrimination when they come out to practice. So when this group of people, they graduate, they serve our community, and then the situation will start changing and to the betterment. So education, that's my answer. Thank you.
Thanks so much. Faith, could you give us some thoughts on this?
Sure. So my job as a first-year graduate student is basically to sit and read and write and think. So I would say in the time that I've been doing that, and I will also add that I spent a lot of time in my undergrad dedicated to reading and understanding obesity, because I knew that I was interested in it. But I think we have a lot of interventions, and we have interventions in schools, interventions in primary care, really intense interventions, less intense interventions. So I think at this point, it's understanding how to implement those in a way that is effective and is able to have an impact on a large group of people. So I think it's going to take the combination of multiple different places and multiple different interventions to best support specifically children and teens, but I also think that extends to adults with obesity.
Great, thank you. And Colin, I'm going to ask you to speak to this, but also a reminder, something that you didn't mention, I didn't mention, but you were also a commissioner for the Ending Childhood Obesity Commission, which was WHO's first big coordinated response, I would say, to the obesity challenge. And that was in sort of 2014 to 2016, I believe. Yeah, and so recommendations from that have been implemented, but again, same challenge, not sufficiently, perhaps not robustly enough. So I'd like to hear your views, both from the sort of the Pacific Island and even sort of Oceania perspective, but also through the lens of ECHO implementation. And then I'm going to start to take some questions from the audience because there's quite a few coming in.
Yeah, thank you very much. Yes, I was one of the commissioners on the ECHO, Ending Childhood Obesity. Disappointing would be a word I would describe the implementation of it. Here in the Pacific region, they have actually taken action to implement aspects of that ECHO Commission report. And one of the key priorities they've identified is really trying to regulate, restrict, moderate advertising of processed food and soft drinks to children. And the answer to the second part of your question about is global coordination necessary? The answer would be absolutely in our part of the world, because most of the food and drink that's consumed in the small islands is imported from Asia, from Australia, New Zealand, and the United States. And therefore, they cannot really regulate and restrict marketing of these products within the Pacific, because the products come in from outside the Pacific. Some islands import close on 100% of the food they eat, and even in fertile islands who can grow a lot more of their food, they import about half of what they eat. So trade is a big deal in our part of the world, and some restrictions, moderation, sensible tread is needed, I think.
Great, thank you very much. So we have a question now coming in from Professor Louise Bauer in Australia. In terms of stigma towards people with obesity, because that's a topic that each of you has referenced, would the panel please comment upon whether this is experienced or occurs similarly or differently in different cultures and countries? I'd be really interested to hear that. Stephen, I'm going to start with you, both from your perspective, sort of personal and professional perspectives about stigma in Malaysia.
That's a great question. Thank you. And myself, I have one part of my research which I want to find out is whether the weight stigma bias thing, is it really felt by Malaysians? Because we have different culture from the Europeans and from Africans. So there are different perspectives and culture. So I would really love to know it. And from my experience, it seems like they internalize it. But perhaps when we think back, whether the concept of internalized weight bias is present in my community or not. So it's a field that I'm so into it to explore. I'm still waiting some medical sociologists to couple with me to do this research. So it's a good question, and definitely different culture. Perhaps they will have different perception on words and the behavior that they are being treated. So that is my comment.
Great, thank you very much. And I think Stephen raises a really important point about internalized bias, that we may not realize we have bias around obesity, but I think as we start to unpack that, and there's fantastic tools for doing so, it can emerge. But Faith, tell me a little bit, both in your personal experience, but also what you see as somebody living in a very, in many ways, a part of the U.S. that has quite a number of different cultures.
Yeah, I would say that I definitely don't think it is experienced similarly among no two people. So I think that everybody responds differently and internalizes it differently and carries it with them differently. So even in Oceans, the vice president and I have had very different experiences with stigma and that internalized stigma, and then deconstructing the ideas we have about obesity and about ourselves as individuals living with it. So I can't speak to a wide variety of people, but I can say in my limited experience and in the experiences I have with others, I definitely think it is a unique experience that would vary among different cultures.
Great. And Colin, I think we've seen research from the Pacific Islands that perhaps suggests different views around this, and I'd like to hear your thoughts on how obesity and overweight in general are seen among different cultures in the Pacific Islands.
Yes, there's been literature suggesting that Pacific people prefer well-nourished individuals, and in fact, big people, overweight, obese folk is not such a negative, doesn't have such a negative connotations, because several cultures prefer people who are not so slim, shall we say. That's a generalization, and then certainly an interesting phenomenon. But I think I want to remind us all that stigma affects everybody, and particularly young people who are very conscious of body image, because there's been research from the same region pointing out the perceptions of young people about their body image, what they say to other people, are not impacted negatively by stigma, but in fact have a major internal concerns about body image and body size. So yes, we do have conflicting research from this part of the world. I think the former comment about preference for people with who are not so slim is perhaps a traditional, somewhat romantic notion that is actually dying out and no longer current. And in fact, I'd be more concerned these days about the perceptions of young people about body image, stigma, self-worth, those kinds of things. They would be much more of a concern to me, I think.
Great. I think we've seen in COVID now, and this is some of the questions that are emerging from our participants. So in COVID has been devastating for people with obesity. I mean, this has been a challenging experience. At the same time, it's also, and again, for those who are not aware, the increase in complications, and then certainly the higher likelihood of mortality are two of just the emerging facts that emerged fairly quickly a year ago when this journey that we're all on started. And then as we've started to look at the numbers, it's true that countries with high rates of COVID death also are associated with high rates of obesity, and similarly, many countries with low rates of COVID death are also associated with low rates of obesity. I would say actually, New Zealand, a country like New Zealand, might be an exception to that, and that's for reasons probably associated with having gone into lockdown quickly and other adherence to the public health policies. But what would you say is this is in a strange way an opportunity to now really have a much more robust response, and I think we're feeling that energy, that like let's come together. What would you say would be the kind of the key actions? What are your observations here about how we can sort of seize this moment and take action and do things a bit differently? Because again, obesity has only increased, and the challenges of it, the other health challenges associated with it. How can we take this moment and really seize it and do things differently in light of of COVID and frankly, in preparation for a next pandemic, of which WHO tells us it's going to happen again, and we just need to be much better prepared. So, Faith, I'm going to ask you for your thoughts on that very quickly.
Yeah, I would say that despite the fact that I am feeling that same energy, I still, as I'm scrolling through social media and seeing people say things that are biased and stigmatizing towards obesity and COVID. So I think that there's one of two directions that it will go, and I hope that the momentum from meetings like this and other meetings happening will push us towards the positive direction. But I hope that this is an opportunity for people to recognize the medical diagnosis of obesity and how that can correlate to care.
Thanks. And Steven, do you want to give us a quick thought on that too?
Yeah, so from the medical practitioner perspective, I would say that please direct more funding to us as a clinical doctors to treat obesity as a disease, whereby the availability of medication, to have a team to give a patient a comprehensive treatment. I would say that will be a great help from this group that you can change the obesity care in the world.
So we had a question from the audience, which I'm going to preface before asking Colin to respond to this question, which is how do we see treatment? How do we see treatment happening in low and middle income countries in particular? We've got some fantastic tools for treatment for obesity, both in terms of nutrition and physical activity, as well as medical treatment and surgical treatment and counseling treatment. How do we address this? How do we have an equitable offer in low and middle income countries? So Colin, I'm going to ask you to respond to that and more broadly to the question about seizing this moment.
I think with certainly the treatment options for obesity in low and middle income countries is challenging, Johanna. Mm-hmm. Gastric bypass, I've been on the record as saying, is not an option in many of the small islands. The facilities just simply don't exist. The second element to this is, as Steven has pointed out, it's a particular skill. There's a clinical skills required to manage these folk well and to manage them competently. And again, I would hazard a guess that these skills are in short supply in many low and middle income countries. And this is, again, a reason why we should join together and to perhaps look at sharing the limited resources across the low middle income countries, because I don't really see that those treatment options as realistic in the short term. Just quickly to the first question, one of the most wonderful things in this country as a result of COVID has been the renewed interest and support for public health. Good old-fashioned public health and epidemiology, because that's really had a major impact on the success of the New Zealand strategy. And people are now saying, if we can do this for COVID, why can't we do this for other global problems like obesity, like NCDs more broadly? And so I would hope that these kinds of conversations will translate to tangible, practical, global action on an issue like obesity, particularly childhood obesity, Johanna.
Thank you so much, Colin. That's really helpful. Michelle Farmer from NCD Child asks, what solutions can be implemented at the family and community level to reduce stigma of obesity? So how can we start with ourselves and with our communities and our families? Can I get some thoughts from that? Faith, could you comment on that? NCD Child is doing a lot of fantastic work in the area of childhood obesity, so I just wanted to call them out and acknowledge them.
Sure. I would say that the most powerful tool we have is education. So educating people on the complexities of obesity, because a lot of people don't know. And then also the media representation and things that we see on social media simplify it significantly. In addition, I think one powerful thing we can do is empower patients to also have those conversations. So it's taken me many years of being very involved in this work to figure out how to talk to other people about obesity who might not understand it. So I think empowering patients with the communication tools to also talk very powerfully about their experiences and to the larger complexities of the multifactorial nature of obesity is a great way to reduce stigma.
Great, thank you. Any other comments from either Colin or Stephen on that in terms of families and communities and how we can work together?
Yeah, Colin here. Just to reflect on an introductory remarks from Dr. Tedros going towards pregnancy, nutrition, and weaning foods. The early weaning of children. This is an attempt to respond to the question of stigma. That in fact these critical periods are the times by which these conversations about a more positive approach to body size ought to take place, because once children get into a time when they are able to be critical of each other, it's probably a bit late. So I do think the pregnancy, nutrition, early weaning period is probably a critical time for some of these conversations to be had within the family and the community. We have a saying that's used around the Pacific region that it takes a village to raise a child. And that's probably where some of these conversations ought to happen, that discourage stigma language and encourage a more positive attitude and approach to body size.
Great. Thank you very much. One of the exciting activities this year is the Food System Summit. Dr. Tedros referenced that, and he's been very active and supportive of that. And that is led in large part by the Food and Agricultural Organization of the UN. So first of all, I'd like to hear from each of you, and then I'd like to turn over to our colleague Nancy Alberto for her own comments. But I'd like to hear if our panelists have any comments in terms of what would be a key message for the Food System Summit. So the Food System Summit, again, is FAO bringing together, stakeholders around the world, and it's been an exciting and inclusive process that we really hope will translate into significant action and commitments. What would be a key message for the Food System Summit? Again, appreciating that obesity is much more than unhealthy diets, but certainly that plays a role. Faith, is there something would you suggest?
Well, I would say the best piece of advice I have is that we need to be making the healthiest choice the easiest choice, and the food system particularly has a very strong influence on that. So for the health of our children and our youth and our teens and our adults, the most important thing is that we make the healthiest choice the most easy and accessible choice at whatever cost that may be. There might be some sacrifices that companies have to make, but it is a very important part of addressing this.
Thank you. Colin?
I was just two quick points. You'll probably pick up from my earlier comments that trade is the big bogey in this region. And so it has to be part of the discussion in the food systems about support for trade in healthier food options. And related to this is really a comment for the agricultural sector, support for and assistance to people to grow their and consume more of what they eat if they can. I realize that access to land is a challenge around the world, but where it is possible to support people to grow and consume more of their food, that would be something I would ask the summit to consider. How to support communities and individuals in this respect.
So sovereign food production, absolutely. So, and I misspoke, by the way, it's the Food System Summit is convened by the UN Secretary General, of course, but FAO is, along with WHO, are leading the implementation of it. And Stephen, did you have any comments for the Food System Summit?
Sorry to be blunt, because one key message to them is that whenever we are doing food summit or is it exercise summit, whichever the fragmented association for obesity management, one key message need to remind them is obesity is a complex disease. Whatever your food implementation policy, always see the others as complement together rather than food as the main treatment. Because whenever you talk food policy, this food is healthy for you, people will wonder that food having healthy diet is the only answer for obesity. So in whatever summit you're doing, because here I know we have a lot of categories of people here, just remember that each and every teams play a major role. Even we are medical doctors in prescribing medication, the surgeons doing the surgery. So the complexity of it need the whole picture of specialties.
A comprehensive and coordinated approach is key. I'll just make one quick comment and then turn it over to Nancy, which is just because it came up the other day. I personally have lived with multiple sclerosis for 30 years, and I've benefited from medication, and I've also benefited from dietary changes. And I tried to describe, like, why is it okay to, why is trade more important, than health in food? And said, you wouldn't allow medicine to have half of it be sort of unhealthy for people, but somehow enjoyable, and half of it to be good for people. And for me, food is an aspect of medicine. It doesn't mean I don't, enjoy different types of food and understand, the pleasure associated with food. But we can make our food a lot healthier and still have, eating be an incredibly pleasurable experience. So we need to understand food as an important part, in fact, of treating obesity as well. So, but not necessary also, but I think, as we're hearing, not sufficient. So it's my great pleasure to have Nancy Alberto from FAO speak to this and to provide some reflections and comments. Nancy.
Thank you, Jana, and good morning, good afternoon, and good evening, everyone. It's really an excellent opportunity, and I appreciate it so much to be here today to share a few of my reflections. I've been taking notes throughout this interesting panel and our introductory remarks, and there were three things that occurred to me that I thought I wanted to share based on what I've been hearing. First is really that I never thought there'd be a global pandemic of a disease of zoonotic origin that could really be a tipping point in addressing the challenges of obesity and overweight. But as you can see, today's entire discussion has been framed in the context of COVID-19. From John wearing his mask at the beginning, from Faith juggling, dealing with her puppy and providing her very thoughtful remarks, all the way to some of the comments from WHO DG Tedros' remarks reminding us of really the life-altering importance of the global pandemic that we're living in. And this moment indeed has really elevated the importance of the slow onset global pandemic in our collective consciousness, and that's the pandemic of obesity and overweight. And today, the diversity of voices have come from a lot of people who focused on this in their lives in different ways, but we're also hearing this in a lot of circles where obesity has not been a topic of discussion beforehand. And that, I think Joanna reflected on it, is an opportunity. And now with the publication today of the World Obesity Federation Watershed Report, really, that brings together that empirical evidence around the connection between obesity and severe and devastating outcomes from COVID. We have all eyes looking at COVID, also looking at obesity. And so addressing overweight and obesity should really be not only a health priority, but also a societal priority. It should be part of our national and global preparedness, and it should be part of our global One Health efforts. And the evidence that we have now, and this report is really important for that, is that we need is critical for us to continue translating that evidence into policy and action. So this really could be a tipping point for us. A second reflection is the role of food systems and how we've never really looked at food systems with the scrutiny and the importance and the visibility that we are today. And that's what the panelists were reflecting on now. But it did start with UNICEF ED Henrietta Ford's remarks. She mentioned the food environments and emphasized that obesity is the body's natural reaction to an unnatural situation. Colin also mentioned really an important challenge coming from his region around food supply and trade, and how this shapes the food environment in many of the Pacific Islands and in many countries around the world. And we need a food system that is going to enable a healthy food environment. So as we're preparing for the UN Food Systems Summit, which has been deemed a people's summit, I hope that all of you are getting involved in dialogues and preparations. We can leverage this momentum for a commitment to action for change for food systems that can effectively support obesity and overweight. Imagine really what a food system could do if healthy foods were affordable. And I think it was Faith that mentioned, or maybe it was Joanna, what if all those healthy foods were the most desirable? What if those were the ones we really craved? What if they were cool and sexy? We can do this, and at FAO, that's a focus of the work that we do is around shaping food systems for healthy diets, but also with an eye towards sustainability, inclusiveness, and resilience. And when we accomplish this, I'm optimistic, when we accomplish this transformation in food systems, we'll be making an impact in overweight and obesity, but also continuing to tackle underweight and undernutrition and hunger, which are also important. And finally, the third thing I thought of today that I wanted to reflect on is that FAO's work in food systems can only make an impact in addressing obesity when there are other impacts in other systems. And I think Steven was touching on this as well, that we need health systems, we need the social protection systems, the education, the transport, and planning that are all people-centered and people-focused that can help support obesity. And I think Tedros said something interesting. He talked about having active systems, and that's kind of a cross-cutting issue because you can have all of those other systems I already mentioned that also support being active. So one thing I'd like to see out of the Food Systems Summit is game changers around how these systems are working together. So how do we have a game changer to show governance across systems, again, that make all of those systems people-centered, for better nutrition, for better health, and for better lives for all. So Joanna, thanks for the opportunity again. Those were just a few things that I thought of during this very interesting panel. And congratulations to everyone for this very successful World Obesity Day event.
Great, thank you. I wanted to, there's a couple of comments that have come online, and I just think this is really relevant in some ways to the food systems points that you're raising there, Nancy, which are really helpful. One was just an observation on social media, and I think we all want to just take a breath and say social media is, it can be very, very, very challenging in the space around obesity, and I think we really need to acknowledge that, that complex ideas don't translate well into social media bite-sized tweets and things. And so to the degree that we can all try to embrace the fact that social media can be used for really effective purposes, but it is, there's a lot of misunderstanding out there. That's again where the narrative is really important. We had Jimena Ramos-Salos, who's with Obesity Canada, notes that there had been messaging in social media around people would rather, we're so sort of terrified of gaining weight that they would rather see gaining weight during the COVID pandemic would be worse than actually getting COVID, which is, I think, in many ways a really sad and important example of weight bias. But how do you see, just quickly, Nancy, if you have any comments in terms of how do we try to to shift the narrative on all sides so that we don't have sort of the negative imagery around weight gain, but that we can also, that we were even hearing is starting to happen in places like the Pacific Islands, but how we can come to a much healthier relationship with and understanding of food as this very positive force in our lives, but also a really important part of our health. Do you have any comments or thoughts on that? Not to put you on the spot too much, but I think it's something that you deal with quite a bit in your role at FAO.
Yeah, thank you, Jana, for the question. It's not an easy question at all, but I like to always consider how we don't talk about a healthy food or an unhealthy food. We talk about diets and how diets can be healthy, and they can be diverse. There's so many options for forming that healthy diet, and I think if we can refocus our energies to thinking about those positive aspects of all those different components that can make a healthy diet. And again, there's just so many ways to get there that indeed, as I mentioned before, that transforming the food system to where the healthy diet is the desirable diet. I think if we know all those options, then we'll move that direction. And I think if we can leverage publicity and advertising in the way, we all carry smartphones today. 10 years ago, we never knew we needed one. And now we can't live without them. How can we leverage that advertising that convinced us of something we didn't know we needed to help support the efforts towards healthy diet? I'd love to see us find a way to do that.
Great, thank you so much. FAO has such an important role to play. I think we have a question from Lucy Westerman from NCD Alliance. I'm not sure if she's going to be able to speak. Yes, perfect. Lucy.
Hi, everyone. Thank you. Yes, Lucy from NCD Alliance, and really commend your work today. The World Obesity Day is such an important milestone every year, and especially this year. I guess one particular comment, picking up on something that Nancy's just mentioned in terms of options, and obviously the Food Systems Summit, is where diet-related NCDs, obesity, they're very much about diet, but there are other factors at play here, and we have to make sure we don't lose sight of those as well. And a big part of the work that we do is obviously around prevention, but we're also looking at that broader health promotion point across the life course for all people. So diet is important to everybody here, but also physical activity and so on. One of the things that I'm noticing is a strong focus on the Food Systems Summit, but we're in the midst of a nutrition year of action. And in fact, in a nutrition decade, this is a massive opportunity that we have not fully grasped yet. And I think, obviously, the Food Systems Summit is very important, and we're all working towards making the most of that. But at the end of this year, we've got the Nutrition for Growth Summit due to be in December or thereabouts, associated with Japan. Huge opportunity there. And I think in particular, we see a lot of investment in undernutrition, which is very important, obviously, very relevant to NCDs as well. But I wonder if we have opportunities to emphasize more double duty actions and investment in double duty actions where we see all forms of malnutrition being dealt with in coherence and concurrently. And we see ministries of agriculture starting to understand that health frame, and investors starting to really value the importance of dealing with all forms of malnutrition at once. Nancy, I'd love to hear your thoughts about that, and in terms of how the Food Systems Summit and Nutrition for Growth are sort of coming together, and how we can all really emphasize this, all forms of malnutrition and double duty actions.
Nancy, okay.
Thank you, Joanna. Thank you, Lucy. And I guess the first thing to say is I couldn't agree more about your comment that it's not just diet, of course, and that is reflected in the remarks of saying that it's not just the food system, that it's all of those other systems, because it's not just the diet, it's all of these other complex components that affect obesity. Now, you're right, and And I'm so glad that you've highlighted the Decade of Action. We're in the middle of the Decade of Action for Nutrition and the Nutrition for Growth Summit as well. We've talked about the Food Systems Summit, but indeed there are these other milestones that we can also leverage. In terms of working towards the Nutrition for Growth, we are indeed at FAO working on linking the actions from the Food System Summit to the food system stream within the Nutrition for Growth Summit, and finding ways to elevate both of these together. Because of course, the Nutrition for Growth Summit goes beyond food systems, and the food system goes beyond nutrition, but there is that important link and overlap. So we at FAO are definitely working to make these two events coherent and have a multiplier effect in terms of our visibility, our advocacy, and our commitments around nutrition and food systems. In terms of investment and double duty action, I think that again, you've hit the nail on the head in terms of priorities when it comes to healthy diet from an FAO perspective, of course. And we actually have a new FAO vision and strategy for FAO's work in nutrition, which focuses on all forms of malnutrition and ensuring healthy diets for all. And this is important because in 2012, FAO had its first nutrition strategy, and it really did focus only on undernutrition. Now, FAO has been working in the area of overweight and obesity for years now, but our strategy, our framework for our work had not kept up with that movement. And so now we have this new strategy that should actually be approved this month in March, focusing on all forms of malnutrition and looking at efficiencies, and efficiencies are those double duty actions. So I think you've hit some really key points, and I appreciate your comments.
Thanks so much to you, Nancy, and to Lucy for that excellent point. I want to remind people, double duty actions are, I think, the way out of this. Double duty, triple duty, i.e., what are the actions that can help with undernutrition and with food systems that contribute to overweight and obesity? So what are simple actions? And in fact, going more broadly into the global syndemic of obesity, undernutrition, and climate change, there are in fact many actions that can be taken that address all three through reforming our agricultural systems. Thank you also, Nancy, for mentioning physical activity, which is a critical component of any effective strategy. I'm going to say a couple more summary remarks and then turn over to Francesco Branca and then to John Wilding. But just quickly, I want to thank everybody for great comments. We have the Roots strategy that the obesity community and many of our colleagues around the world supported last year, recognize obesity as a risk factor in disease, obesity. Each letter stands for a different element. And I think the point is that a comprehensive strategy is the way forward and the way out of our current challenges and the way to prepare for the next pandemic. I appreciate a question in the Q&A box from Arya Sharma, who mentions we've gotten to this extraordinary accomplishment with a vaccine, and I've had one because I have what's considered a comorbidity, and many millions around the world have already gotten it. Millions and billions more need it. But if we've shown what can happen when you all work together, which is extraordinary. And are there ways that from the healthcare side, the treatment side, that we can apply those same principles to obesity? Let's advocate for that as well, because that's a tremendous opportunity. And so now I really want to just have our colleague, friend, and supporter at WHO, Dr. Francesco Branca, who's head of nutrition at WHO and truly a champion for this issue. He would like to say some remarks. Thank you, Francesco.
Thank you very much, Joanna, and thank all those who gave us such important insights in this day. And days, years, decades are made to act. So we're really energized by having this partnership and having the collaboration among all our organizations. It seems so obvious. If we want to address such a challenging issue, such as obesity, we need to join forces. We need to work across the board, from prevention to management. We need to start early, and we need to focus on some elements which could be game changers. And we heard this term used for the Food System Summit. We're all trying to identify what the game changers are. There are game changers also for obesity. And this is the time to all work to decide what they are together, and we know what they are, and work to make them happen at scale. I think this is the time I think we should remember this 2021 World Obesity Day as really the time when we start seeing that terrible epidemic curve going down. We've seen in these days all these epidemic curves, and at some point somebody says, oh, but actually the cases are going down. We want to see this happening for obesity, and we want to see this happening now. Otherwise, we'll never get those targets together. And we understand how this is important for the Sustainable Development Goals. So happy to work with all of you, and particularly with UNICEF, World Obesity Federations, Bloomberg Foundation. We have to start something to really energize and address the obesity with urgency. Thank you.
Thank you so much, Francesco, and World Obesity Federation, which again, we are a membership organization. We have members in 60 countries. We have members in every continent, and we stand ready to partner with all of you. And this is game changing. This is a game changing moment for us, and we will not we will say that this is marked the turning point in the growth of this. I want to again thank our panelists. So I thought did a really fascinating job. And really speak from frontline experience, and are truly experts and advocates for our cause. And I want to thank all the different people who have contributed questions and thoughts on this. And now it's my great pleasure to close out our session today with Professor John Wilding coming on for final remarks.
Thanks very much, Johanna. It's great to listen to this really fantastic meeting. I'd first like to thank everyone who has spoken. It's great to have had support from WHO, from Unicef, from Bloomberg Philanthropy, and everybody else, FAO, everybody else who's spoken and supported the need for action on obesity. As mentioned right at the beginning by Tedros, this has really been brought into sharp relief by the COVID-19 pandemic. And we really do have to urge governments around the world to seize the moment, put obesity at the top of the agenda, both strategies for prevention and treatment as we recover from the impact of COVID-19. And of course, there is opportunity for triple benefits here. We've heard discussion today about the syndemic of undernutrition, malnutrition, climate change. Many of the actions that will help manage and support the interventions to prevent and treat obesity are actually synonymous with those goals as well. So there really is a great opportunity to do something now. We do have to work with everybody around the world to increase awareness, to recognize that obesity is a disease in its own right, as well as a risk factor for a whole host of other diseases. Advocacy is really important. And of course, we're working in partnership with people living with obesity to address issues such as stigma and implicit bias that we've talked about today. These are really important because that will help us change the narrative and move away from blaming people, asking them to eat less and move more, towards the systematic approaches that are really needed if we're going to tackle obesity as a disease around the world. Lots of us have got experience, both from prevention and treatment strategies. We need to share those experiences. And we need to think about how we can encourage governments to think in just about everything they do when they're thinking about infrastructure projects. What's going to be the impact of that on obesity? If we build cities and transport systems that encourage active transport, that's going to be a beneficial thing. If we do it the other way, it's probably going to make the obesity pandemic worse. And again, with the food systems, it's thinking of the impact and making sure that everything we do is pushing the dial in the right direction. And then finally, of course, from a health systems perspective, we need to make sure that treatment is available for people around the world, not just in countries that have a high level of resource to support healthcare. I think I should stop there. It's been a fantastic morning and or afternoon or evening, depending on where you are in the world. And I hope everybody will go away really empowered to take action on obesity in the next few years. Thank you very much.